what always rings true for me is that we are in this profession because we do love helping people, even no matter how cheesy that sounds. But the problem is that if we're so strung out trying to help people all the time, we aren't the best people for them. And certainly our health will deteriorate as a result of it. So you can get away with a lot when you're younger. And, the medical training especially leverages that or exploits that in people because they can get you to work 30-hour shifts every 4 nights and, take a week off, every 3 months and a weekend off a month and things like that. And you can somehow rebound, but that's not going to last. And you can see it in certain types of professions. If you're like in the emergency room, like our colleague Alan, for example, like people don't last that long. They actually retire earlier than any other profession in the medical world.
All right. Welcome back, everyone, to the Smarter Not Harder podcast, your home for 1 cent solutions to $64,000 questions. I am back and I am Jodi Duval and I'm with the team again. We're doing a cute little episode on how we can support you practitioners to not burn out. And so we are going to give you our tips and tricks so we can all thrive as practitioners, helping all our amazing clients. So where shall we start, gentlemen?
Should I start, or Dr. Ted? What would you like?
I'll start. Let's go around robin, right?
Yeah,
let's go around robin.
Okay, sounds good.
My first advice is really for not burning out is really to choose your clients. Remember, they have the power to choose you, much as you have the power to choose them, or rather reject them. So
not create a beneficial or a therapeutic relationship.
Yes, if in the first instance you already are in bad vibe with each other, just copy what I say. It's like, I'm afraid I cannot establish a therapeutic rapport with you. Would you like me to refer you to another practitioner? So,
yeah.
And that has saved me a lot of time, a lot of heartache, and really a lot of getting burnt out with clients that you don't like, right? I have this personal rule in my life, which I'm going to share with you. No amount of money is ever going to pay for your emotional aggravation. So... and I learned that very early. So my advice is like really, really choose a demographic, right? Make sure you love the demographic. I really, ever since a child, I really love taking care of older people, right? And I really have a soft spot for older people. And my reasoning is, it's like, hopefully when I'm older, someone will take care of me and love me the way I actually love them. Right. So and that's how I avoid my burnouts. I only have a limited number of clients, but I love all of them and they love me. Right. And they consider me not not only as their healthcare provider, but also their friend, their confidant, and someone that they could actually bother in extreme emergency. Right. So you're part of the family. So, but it has its drawbacks, like what families do. However, it has prevented me from having a meltdown with any one of them, and just maintain a decent count of clients. That will allow you still to live the other parts of your life. Not just taking care of other people. Although they say that service to other people and service to the world, is one of the best reasons that you can have for being alive. Right?
Absolutely. Yeah.
I love it.
I always tell people, my clients, that I want to do this for the rest of my life. And to do that, you have to do it well and you have to enjoy every moment of it. And yes, it gives a lot back, but you're absolutely right, Ted, it can take a lot as well.
Indeed. Yeah.
Yeah. All right. So, Scott, I think you should go next. What are your tips and tricks?
Well, it's always hard to follow, Dr. Ted. That's why I was hoping to go first, to be honest. But what always rings true for me is that I think Ted, you mentioned this at the end there. We are in this profession because we do love helping people, even no matter how cheesy that sounds. But the problem is that if we're so strung out trying to help people all the time, we aren't the best people for them, and certainly our health will deteriorate as a result of it. So you can get away with a lot when you're younger, and the medical training especially leverages that or exploits that in people, because they can get you to work 30-hour shifts every 4 nights and take a week off every 3 months and a weekend off a month and things like that, and you can somehow rebound, but that's not going to last. And you can see it in certain types of professions. If you're like in the emergency room, like our colleague Alan, for example, like people don't last that long. They actually retire earlier than any other profession in the medical world. And so my big thing, and this is recent for me, I mean, I think overall, really until I hit my 40s, it wouldn't even been on my mind, but like I said, taking care of myself overall. And so prioritizing my own capacity to help people. And if you also can get very drained if you are not working on your own avatar before and during and after seeing lots of patients. It drains you to see all these people. Like you take on their emotions, you take on their pain, their suffering. Like you don't want to do any of that, right? So you want to have the capacity to be able to create space, but also have the intention to help them, of course, but not exploiting yourself in the process. And so I agree with everything that Ted said. I think that the main things I've found over the last several years is that you got to take care of yourself. If you want to be the change in the world, you got to start with yourself.
Well, actually, Rumi, right, the Persian poet, said, when I was young, I wanted to change the world. But when I was wise, I wanted to change myself. So that has been a very inspiring quote for me from that poet.
Absolutely. Absolutely. How
about you, Jodi?
All right. Well, I guess so for me, there's a few things I hold to high esteem when I'm trying to look at. I second all of that, Dr. Ted, Dr. Scott. But the other thing I look at is having the community around me. And when I was initially out as a naturopath and was in studies and found myself in practice, it was a very lonely practice. And I think even though you're surrounded by people sometimes, even in a hospital, it can be such a lonely thing. So what I held to such importance is creating a beautiful team, a beautiful community, or having access to. And that's one of the things that I love about the clinic that I've created here and being a part of Home Hope, is that we all support each other. And you have friends, you have families within your colleagues, and I feel like without that, we can't do our best work. And I feel that that's where we bounce ideas off, we learn, we support each other, we are there when we feel like we can't solve a problem, and even in the flesh, we are always there for each other. Hugs, love. It's just a beautiful thing. So I value that so much, and I hope I have that for the rest of my life, is a beautiful community of amazing practitioners and doctors and friends and family to support, because really if you don't have that, you can't do the self-work on top of that, and you can't survive the long days and the really tough cases. I really, that's sort of like my number one, I would say. My number two is, yes, looking after myself, but we as health professionals have access to a plethora of information. And so my golly gosh, it gets so overwhelming to be thinking constantly about the things that we should and shouldn't be doing. So over the years, again, I've made the mistake of becoming very orthorexic and then coming away from that and creating that balance again. And so for now, I find having fun, but also valuing my health, and then being, showing both sides to my clients. You don't have to be perfect all the time. It's too much pressure. And so we now have the tricks, and we now live smarter, not harder. So we can then be able to have those beautiful things that we can learn and have on the outside of the things, and then we can correct them. And then have and experience the joy as well. So for me, I think, yes, I've applied all the things I try and do: exercise, movement, breaks, meditation, water, hydration, minerals, testing myself, doing all the things. But it really comes down to
ground well, love well, all those things that Ted talked.
Exactly. Yeah, Ted's beautiful poem, I call it, of the musts and the non-negotiables. So all that's there, but I feel like there has to be that balance. Absolutely. So they're my sort of two.
I love it. Ted, do you have any thoughts about this?
Yeah, actually, Jody touched on something that, for us, both the boon and the bane of my existence as a practitioner, because you're a health optimization medicine expert, right? Then you practice what you preach. You walk the line, you know? It's like you can't be like a pulmonologist that smokes, or an endocrine metabolic expert who is obese with diabetes. It's, you have to walk the talk, right? You have to follow your own advice, and one of the most difficult things in life is to follow your own advice, right? That has been talked about so many times. You can advise a good friend and say, if your friend followed your advice, everything will go fine, but you yourself couldn't follow the same advice. So why I say the boon of my existence is that, well, there's a reason why I'm very healthy at my age, right? But the bane of my existence is that I have to do these fucking things over and over, right? You have to exercise, you have to eat, you have to eat reasonably well, right? You have to they have to test yourself, and that's the other thing with practitioners is, right? You're doing the testing for your clients and your patients. You have to test yourselves at a regular schedule to see what's happening to you, right? I always like to say it. The airplane analogy is like, put the oxygen mask on you first before you help others. As same is true here. You have to take care of yourself first before you can take care of others, and that requires a regular checkup on your part. What's going on with you? With me too, for example. I am so sick and tired of, say, injecting testosterone or, doing this for hormone balancing, but you have to do it, right? And then some people, initially practitioners who do these kinds of balancing, they like it so much that they don't stop. Well, here's the news for you guys. You have to rest, the body from these things at a regular schedule also. Even from supplementation, there's a rest schedule for all of these. If you think of supplements as food, you're just supplementing food, right? Your body is not eating, citrus bioflavonoids every day, right? You don't eat oranges every day, right? So you think of your supplements that way. There are schedules for them. You put them on for 90 to 120 days yourself. This is what you advise your clients, and that's the other thing. Try the program on yourself first, right? Before you put it on your clients, because make it easy for your clients to comply, right? If you can't comply it, how do you comply with it? How do you expect your clients to actually comply with your protocol? So practice with yourself, make it fun on yourself, right? So and make sure that you yourself practice what you preach. That's what I have to add to, Jody actually mentioned a lot of this, but, and that's why, hey, you have to look good, you have to exercise, you do this, you have to be glowing when you're doing that without any additional makeup or surgery or, liposuction or anything. You're just looking great, right? And that's the magic of it at the same time, right? It actually sucks, but it sucks in a good way.
Yeah, it's that consistency that we have to show. Just like you said, Ted, it's definitely something that we have to apply ourselves. Otherwise, we are not able to tell anyone what to be doing. And it's hardcore. It is. We have to be able to do a lot of those things. And whether we like it or not, it has to happen every day. Some part of looking after ourselves. So yeah, no, I love that. And Dr. Alan Bookatz, you are right on time for your go at how you would give your tips and tricks for practitioners to best look after themselves, things that you value for yourself.
That's a great. Can you hear me okay? Just quick AV check.
Yeah, we can.
Okay. No, that's a great question. I think so. Sorry, I'm in the uniform gear today. Just got off a shift. Yeah, I think what we often fail to do, a lot of us are so focused on the patient, the client, and the simple things like taking micro breaks from, when we're going case by case or someone is suffering and we want to help them, we want to get a plan in order, get them and their lives back on track. We don't often think about how, as we're going through our own flow during the day, are we doing the things that we're asking them to do? Like, are we hydrating well? Are we getting out and sunning well? Are we taking micro breaks and doing some type of like physical activity? So I think I think this was said a little earlier, but like setting examples for that kind of stuff. So for example, I think for something that I find is really helpful is just, setting an alarm every hour on the hour, get up and go for a walk. And I'm lucky that my house is full of stairs. So if I'm doing a lot of work, I'll just grab my weighted vest and I'll walk up the 30 steps in my like townhouse and just get all the way up and all the way down nice and slow. And I'll get a little bit of, get that heart rate up, get that muscle activation, get the blood and the lymph flowing. And then naturally that'll get me a little thirsty. So I'll hydrate. But I think if I don't have built-in reminders, every hour on the hour to remind me of that, then I just forget to do those things that I know are really good for me. So making it like easy, making it simple, and being able to like spread that out through the day, for me at least, is the advice I would give, because this has been something that I've been able to hold myself account to. For a long time, I used to think, I'm just going to be sedentary all day and then just do a 2-hour, or a really intensive 1-hour workout at the end of the day. And I think what ends up happening is that ends up getting deprioritized, or when I do it later, I'm there's not much left of me to really put into that. So, and I find that the entire day goes a lot smoother when I incorporate that stuff on a more regular basis.
I was just going to follow on, Alan, is that I think when I've noticed, again, yes, we push through. I think as practitioners, we feel like we have to push and get to the end of the day. And I also have been trying to apply these mini breaks as much as I can, the sunshine, the movement, the water, the hydration, the food. I think food's a big one. I myself have. But by the end of the day, if you don't do any of those things, you've got nothing left over, and it takes a lot longer to build up that resiliency back again. And so by having that, you have more left over for your family when you get home. You have more left over for the joy and actually experiencing that, instead of completely conking out and having no mental capacity whatsoever. So I think the mini things like that, it's such an important point. So thank you so much for saying that. I think, we've covered so much today already.
Yeah, right on. I mean, I think, Jodi, I also want to just echo what you said a little bit earlier about community, because I wouldn't be here with this crew, with your crew, if it wasn't as important as it truly is. And I think one thing that medical school, residency, even being a hospitalist for many years, really does instill in you is that there's always people around you for you to talk to. And I always really enjoyed that in school, in training. But when you go out into the real world, quote unquote, you get less of that interaction, less of that capacity. And so you have to create these groups for yourself and find ways to continue to have the engagement. And whether you're an interventional cardiologist or you're a health optimization practitioner, like if you're in a silo on your own doing things, it's kind of boring and kind of lonely, right? And so I love that we have a big WhatsApp group for our Home Hub students, those who have gotten through some of our modules before, to have some amazing conversations, really great people talking about amazing things. Although Dr. Ted typically has to bring everybody back down to first principles, as usual, from an evolutionary perspective. But that's the key with health optimization medicine in general. And the challenge that all of us have is that we all kind of cart before the horse sometimes when it comes to dealing with various issues or thinking about various conditions, rather than looking at it from a first principles perspective. But the ability to have you guys as colleagues and also have the community for Home Hope is really why I do this, why I can do this, really, because there's always people to talk to if you have questions, if you don't know how to deal with somebody, or how to address it, or what angle to go in. We have lots of different people with lots of different types of training out there to help within our community, which is fantastic. So
absolutely, I think that's incredible. So I think we've gone around the horn and we've said some amazing things and tips and tricks. So is there any last parting words from everyone? Maybe a one tip 2-tip, and then we can tie it all up. That was probably not right, but yes.
No, I know what Dr. Ted's thinking right now, and it's from a movie
Yes.
that is not appropriate.
Yes, I think I know which one.
Just 1 tip, not 2 tips, Ted.
Sorry, 1.
Hey, I was thinking of something benign, like a Q-tip. Hey. See, I can be G-rated. The key here actually rests in just a few words, right? The first one is fun, right? Being a practitioner is fun to do. And one of the things that makes it easier to be fun is that if you love what you do, right? And loving what you do comes in with a lower level, which, as I said earlier, is that do you like being of service to other people, right? And ultimately, it actually resides in like do you derive satisfaction in helping other people? Because if you don't, you derive satisfaction in making money in the stock market. That is really not good for you, right? Because you will be many a patient that you love and would like to get better is totally stubborn, hard-headed, etc. But you do understand where they're coming from because, much as health optimization medicine teaches you to look at not at the level of the body, but at the level of the cell, right? I am a cell, what do I need? It also actually forces you to put yourself in your client's shoes and say, you're asking me to do what? Take 36 supplements, et cetera, right? So, and that's my, the second word here is that, what makes it fun is also your degree of compassion for yourself and for your clients, right? So, you remember what's good for the goose is good for the gander here, right? In terms of you're doing the same tests on yourself as you're doing for your clients, you're doing the same supplementation and so on, and behavioral and nutritional guidelines, right, are all test driven, right? So don't guess their diets, right? Don't guess their nutritional needs. You have to base it on what's coming out of your test. So and that and the thing that I always say to my students is always remain curious. Like if someone says, this is the mechanism for XYZ, be a 2-year-old and ask why. Now, why is that mechanism for that? And there are just some mechanisms that will frustrate you because there are no mechanisms known yet, right? So you just have to set them apart because you can drill down and be totally know about what, dehydrogenated water or deprotonized water or whatever, is going to do, et cetera, what the mechanisms are. Well, what the fuck? What does that have to do with my client? So you always have to walk the line, and it's going to be fun. Walk the line between, what's going on in the research area and what's going on in your clients, because we're not evidence-informed. We're not evidence-based medicine. We're evidence-informed medicine. Right? So we take a look, because the distance from actual clinical trials, in illness medicine is about 10 years, right? The shortest is about 6 years before any drug or intervention comes to your clinic. It will be about 10 years. Whereas it was published like January of this year. By November, it's already in our clinics, right? So and bridging that, it requires a lot of curiosity on your part, right? And so always remain curious. It will the other benefit is that it will keep you young. So we say that health optimization medicine is about the quality of life, right? And we say that longevity, or the quantity of life, and disease prevention are its mere beneficial side effects. So practice that in your life. Make sure that the quality of your conversations, not only with your clients, but with your family and your friends, etc. Where you pay full presence to them, because that this moment is not never come again, right? And then it's going to be a next moment. It's going to be a new one. So and that's what I would like to close this with. Have fun, have compassion for yourself and for your clients. Remain curious, right? And remember, there are things that we don't know yet, and even if we do, it's probably just another story to make us feel better. All right.
I think we can close there, Jodi. I don't know if I don't think Alan and I or you
We
can
can't
match
top
that.
Yeah, there's no topping that.
No, I think that's a perfect way to close. So
Beautifully said. Yeah.
yeah. Thank you so much, everyone, for joining us on another episode. We'll be back again next week. And if you like what we do here, which I'm sure you do, you can like, subscribe, comment, tell us what more you want to hear about, all the things. And we will see you very, very soon with a lot of curiosity. Goodbye.
Bye, everybody.
See ya.